Hello everyone, welcome to this lecture on osteology, focusing on hip bone as well as femur. I am Mrs. Shanmugapriya, your lecturer at SNS College of Allied Health Science, affiliated with Dr. MGR Medical University. Today, we will explore the structure, function, and clinical aspects of the hip bone. Let's begin. So, the introduction to hip bone is usually the hip bone is also known as innominate bone. It is a large bone and also it is an irregular bone that forms the pelvic girdle. It connects the axial skeleton, which is the spine, to its lower limbs. It composed of three fused bones: ilium, ischium, and pubis. Its main function include weight bearing during standing, walking, providing attachment points for the muscles also. And it also protects the pelvic organs like bladder and reproductive structures. Looking at the diagram on the slide, you can see the lateral and medial views highlighting these components. And next, we are just going to deal with the location of the hip bone. So basically, the hip bone forms the lateral and anterior walls of the pelvis. It articulates posteriorly with the sacrum at the sacroiliac joint and anteriorly with the opposite hip bone at the pubic symphysis. The acetabulum is a deep socket on its lateral side that receives the femoral head. It also to form the hip bone. Overall, it's positioned between the lumbar spine superiorly and proximal femur inferiorly. So refer to the illustrations here showing the lateral and medial perspectives for the better visualization. So next we are just going to deal with the parts of hip bone. So starting with the ilium. Ilium is the superior and largest part of the hip bone. The key features include iliac crest, which is the superior border you can palpate at your waist level. And we also have iliac fossa. It is a concave inner surface that accommodates the iliacus muscle. The anterior superior iliac spine serves as the attachment for the inguinal ligament, and the posterior superior iliac spine it is a palpable landmark used in clinical exams. So finally, the greater sciatic notch. It allows the passage of sciatic nerve. The slides diagram label these clearly in the lateral and medial views. So the next we have the side determination. Next we have the ischium and pubis. So moving to the ischium, which is the posterior inferior part, it includes ischial tuberosity, and which bears the weight when you are sitting. And ischial spine, it is a landmark of measuring pelvic dimensions, especially in obstetrics. Next, we have the pubis, which is the anterior inferior featuring the pubic symphysis as a midline. And next, the superior and inferior pubic rami that helps to form the obtutor foramen, a larger opening of vessels and nerves. The acetabulum is contributed by all these three bones, articulates with the femur. Check the labeled views on the slide for these structures. And next, we are just dealing with side determination. So to determine if a hip bone is from the left or the right side, the acetabulum faces laterally and the iliac crest is superior and curved outwards. The pubic symphysis is medial and anterior. The obtutor foramen is inferior to the acetabulum and tends to be larger in females due to pelvic differences. Orient the bone with anterior superior iliac spine pointing anteriorly and ischial tuberosity inferiorly. This slide diagram demonstrates its orientation in lateral as well as in the medial views. So next we are just going to deal with the ossification of hip bone. So ossification of hip bone involves primary ossification centers like in ilium, ischium, and pubis, which appears during the fetal period around 8th to 12th week. The secondary centers develop in the acetabulum and iliac crest and also in iliac tuberosity. During puberty, the full fusion occurs at 20 to 25 years of age. And clinically abnormal ossification can lead to congenital hip dysplasia where the acetabulum doesn't form properly, affecting hip stability.